Buhweju district is reportedly among the districts that have registered serious cumulative cases of COVID-19, though it has registered only one death. The current fights between the area RDC, Harikundira, Africano, and members of the District Taskforce could contribute to further spread of the virus in the district. The sources of misunderstandings originate entirely from the COVID funds government sent to the districts.
It is true that the money that was meant for COVID-related matters, money that was sent in districts, in sub-counties, was misused. Some was stolen.
I would rather live to be a chairman RC5 than supporting those thugs. Over my dead body, I can't and I cannot.
How can an RDC mismanage COVID funds when he cannot access them? That is question number one.
District leaders allege that the RDC connived with the sub-county chiefs to misappropriate over 35 million shillings allocated for the fight against the spread of COVID-19 at sub-county level. Unconfirmed reports indicate that some of the funds were spent in buying personal laptops and school furniture, even when schools are under lockdown. The RDC Harikundira Africano denies all the accusations leveled against his personality, saying government has never advanced COVID funds to the district.
You can imagine this is when we are fighting COVID, but you find somebody procured a laptop exorbitant at 3.6 million.
Government has not released funding for COVID activities. Me as an RDC, I have not received any documented release from the Chief Administrative Officer or any communication from the Minister of Finance telling me that the Buhweju district has received funding.
The fights between the leaders and the RDC began way back when Atuhaire Dewo, now the district's chairman, was preparing his swearing-in ceremony. It is alleged that the RDC had to stop the gathering, claiming it was against the presidential directives in fight against COVID-19. The stalemate has already been reported to the Secretariat of RDCs.
So they can see how to reconcile the RDC and the politicians in Buhweju.
Aren't these disagreements deterring the efforts in the fight against COVID-19 in the district?
No, absolutely not true.
There is a very bad mentality of the people of Buhweju, because when the 78 cases of 2020 did not become fatal and nobody died, today people think COVID does not kill.
Harikundira Africano reported in Buhweju in January this year, but leaders claim even the 40 million shillings that the MPs returned during the first wave of COVID-19 is nowhere to be accounted for. Leaders maintain the current RDC must be transferred to bring sanity in the district.
It is not an individual demand to be made from Buhweju district, from an individual, that the president transfers a person.
The RDC must know that he's here to serve the people of Buhweju. He must respect all the elected leaders.
Buhweju district has 279 confirmed cases, 112 are under home-based care, with one reported death. The district is grappling with lack of ambulances, medical supplies, PPEs for health workers, and limited capacity to take care of the patients under home treatment.